All right, good afternoon, everyone. Good afternoon. I want to thank the city officials, community, and labor leaders joining us here today. Department of Public Health Commissioner Dr. Allison Arwady, Alderman Gil Villegas, SEIU Local 1 Vice President Ephraim Elias, and Carmen Varega, Chief Operations Officer of Esperanza Health Centers. 4 weeks ago, we came together to announce the significant disparities that our cities experience with respect to COVID-19 cases and deaths. At that time, Chicago's African Americans accounted for over half of our city's cases and 70% of our city's deaths. Those findings were breathtaking and led us to take immediate action. This included forming our Racial Equity Rapid Response Team, a data-driven effort deploying a hyper-local strategy to mitigate the disparate outcomes in our communities, ramping up our communications, organizing community-level briefings with residents, supporting on-the-ground efforts to disseminate masks, and connecting residents to information and resources so that they could access essential care and support. But our work continues, and we have reached another critical moment for our city, confronting the impact of COVID-19 on Chicago's Latinx community. With increased testing, improved reporting, and the continued spread of this terrible virus, we are seeing a surge in cases amongst our Latinx residents. And this demands that we dig down deeper and work harder to confront this reality. Now, I'm going to invite Dr. Arwady to break down the data in a moment, but this is what we're looking at. 4 weeks ago, our Latinx community accounted for only 14% of cases and 19% of deaths. Now, we've been working in the Latinx communities all along, but we noted 4 weeks ago that we worried about an undercount. Fast forward to today, and those levels have more than doubled, with Latinx individuals now accounting for 37% of Chicago's COVID-19 cases and 25% of our city's deaths. No less breathtaking than the numbers that we reported on a month ago in the Black community. And unfortunately, those numbers are on the rise. As Dr. Arwady will note, this new data is due in part to our increased texting capacity. Meanwhile, some of it is due to better data collection following our public health order, which we issued in the wake of last month's data release, requiring more accurate case data reporting related to race and ethnicity. Now, we haven't reached where we should be. We still have to press providers to make sure that we're getting this important information. But the fact that we are getting more people coming into compliance shows that the impact of this virus on communities of color. The maps we have here tell another familiar story. It's a story about resources and inequality, about healthcare access, job access, and community investment. Dynamics we know all too well in our city. When looking at data at this scale, it's easy to forget, but we cannot, that these aren't just numbers. They are our people, their families, their parents and grandparents, brothers and sisters, friends and loved ones who are sick and afraid for their lives. These are our neighbors. And that's nothing to say of the suffering and worry of the families and loved ones of these individuals. I will speak about the actions we'll be taking to address the challenges we're facing, both near-term and long-term, and how they'll be tailored to the lived experience of this community. We're not doing a one-size-fits-all approach to addressing the ravages of this virus. But first, I'd like to invite Dr. Arwady to the podium to walk us through the data and show us what's happening. Doctor?
Thank you, Mayor Lightfoot. So as always, I will invite people to go to chicago.gov/coronavirus. Right up at the top, there is a tab that says latest data and reports. And every single day, the Chicago Department of Public Health updates our demographic data, age, gender, and race ethnicity for both cases and deaths. 3 times a week, we update our maps showing cases and deaths. And once a week, we update all of our testing data. There's also additional, much other analysis, and I encourage you to explore. So first, where are we as a city? We are still at the stage where we are flattening the curve. We are not yet coming down. And so all of the data that we show here, just to be clear, is in Chicago residents. So we follow the city of Chicago's data, just as the state of Illinois shows Illinois data. So whereas at the beginning of this outbreak, less than 2 months ago, we were seeing cases double every 2 days, every 3 days, every 4 days, we are now at a point where they're doubling every 15 days. Major progress, but still not at the peak. We expect to see that peak in May, but that is why we need people to continue to adhere to the stay-at-home order. 1 month ago, we had 5,043 cases and 118 deaths here in Chicago. Just 1 month later today, we're at 26,611 cases and 1,096 deaths. We're making progress, but we are far from out of the woods. This graph gets at some of the differences in these curves that we've seen by race ethnicity. So let me orient you to this slide. The x-axis shows week by week by week over the last 7 weeks. The x-axis shows how many new cases we're having each week. And the different colors represent the different race and ethnicities of Chicagoans. So in purple, we have Black, non-Latinx Chicagoans. And you can see that very early on, we were seeing a big rise in Black Chicagoans, and then we've actually seen new cases flatten and even start to come down. Now, I want to be clear, we are still seeing a lot of cases in the African American community, more than 1,000 new cases a week right now. But you can see that overall, there has been some progress in terms of the curve. The red represents white Chicagoans, the yellow represents Chicagoans of other race ethnicity, the green represents Asian, non-Latinx Chicagoans, and that blue represents Latinx Chicagoans. And so you can see that whereas early on we were not having a lot of cases in Latinx Chicagoans, and some of that may have been to do with some of the underreporting of ethnicity in particular, less testing and fewer cases, that particular group you can see has been on the rise, and then over the last 2 weeks, the number of cases has actually exceeded the number of cases that we've seen among African American Chicagoans. So as of now, Black non-Latinx Chicagoans and Latinx Chicagoans each represent 37% of the lab-confirmed COVID cases in Chicago. In comparison, 17 to 18% of our cases are in white non-Latinx Chicagoans, approximately 3% in Asian non-Latinx, and about 5% in people of other race ethnicity. These are among people for whom we have existing race ethnicity data. Now, I'll remind you that as a city, 29% of us have Latinx ethnicity. 30% are Black non-Latinx, 33% are white non-Latinx, and 7% are Asian non-Latinx. So we can see that now in both the Latinx and the Black communities, we are seeing more cases than would be expected given the breakdown of Chicago. 1 month ago, as the mayor noted, Latinx Chicagoans represented just 14% of our cases. So we've moved from 14% to 37% just over the month. Next. So you can explore this much more online, but wanted to highlight this is our current data about the cumulative cases, the total number of cases that we've had in Chicago residents by zip code. There are 7,156 lab-confirmed cases among Latinx Chicagoans, and you can see that a lot of those highest case counts are in communities that are predominantly Latinx. Little Village, Archer Heights, Brighton Park, Gage Park, Chicago Lawn, and Belmont-Cragen. Next slide. COVID deaths remain disproportionately higher in non-Latinx Black Chicagoans. We have 1,096 deaths among Chicagoans of COVID-19 at this point. 554 of them, or just over half, 52%, are in the Black non-Latinx community. 266, or 25%, in the Latinx community. 186, or 25%, in the white non-Latinx. 50, or 5%, in the Asian. And you've seen us use this map before, but each dot on this map represents a person, and not just a person, but a person's family. Each of these is a death from COVID, a major loss in that community. And we can see, using the same colors there, purple represent Black non-Latinx, blue represent Latinx, and so on. You can see again that the deaths among the Latinx community are concentrated in those same communities. And finally, this is a slide showing where we have done a lot of focused testing as a city. So every single one of Chicago's 67 zip codes has seen major increases in testing. We are making very good progress, although we still have a long way to go. So looking back over the last few weeks, every single zip code has had at least a 50% increase in testing. But our largest increases, in many cases doubling of testing even by the week, have been in the predominantly Latinx communities on both the southwest and the northwest sides. That is important. It needs to continue, and it is one of the priorities as we think about driving testing wherever it is most needed in Chicago. I will note that the Chicago Department of Public Health always responds to cases of COVID-19 just as we respond to all other infectious disease cases, regardless of race, ethnicity, geography, age, gender. We go where the disease is. And so all along, we have been investigating cases in Latinx communities, just as we have in communities across the city. But where we are seeing increases, it means a need to make sure that we are redoubling efforts, making sure that folks have understandings that as the disease continues to really shift across the city, shift in time, shift in place, shift by race, ethnicity, we alter our focus, and we want to get that message out. So in addition to continuing to work on the reporting of race and especially ethnicity, it's been a big focus, it will continue to be, we're also doing additional analysis, and I encourage you, if you're interested in this, to join. I do every day at 11, we do a Facebook Live update, and we'll be showing some more data that the Chicago Department of Public Health has been looking at, things related to crowded housing and intergenerational housing, things related to occupations and where there may be more essential workers. Some of these have particular resonance for Latinx communities in Chicago, and we'll talk about it. We also continue always to investigate clusters. And so as we've been doing cluster and outbreak investigation in workplaces, some of these are large workplaces with a lot of Latinx employees, and so that has and will continue to be a focus. We're also really working to make sure that people are connected to care, people are connected to quarantine and isolation facilities, people are getting information. So I won't take any more time. My goal was just to show you some of the data, and I will be pleased to turn it back over to Mayor Lightfoot and to everyone else who's going to help tell some of the story of how we continue our work here. Thank you.
Thank you, Dr. Arity. You know, as you can see, these numbers are quite profound. And they call us to another moment of action and a sense of urgency. Equity and inclusion are not just feel-good expressions. They truly are, in the middle of this pandemic, the difference between life and death, and the imperative we must embrace as a city and as a society. Nothing about this is okay, and we can never allow ourselves to think that it is. We have to step up and answer this challenge and this call to action, and that is exactly what we're doing. Our first step is expanding the focus of our racial equity rapid response team. And I'm pleased to say that Nubia Willman, who's here with us today, the head of our Office of New Americans, will be formally joining her colleagues from the mayor's office as part of that team. Given what we saw around mortality 4 weeks ago, the team initially centered strategies focused on areas with the highest mortality rates and will continue advancing that work. Now, in addition to that, the team will be zeroing in on areas where we see the highest increases in case rates. The data calls on us to take a regional approach in the Latinx communities, and that means standing up teams on the northwest and southwest sides of the city, partnering with key stakeholders in these two regions, focusing on anchor institutions and trusted community partners. Each community has its own unique set of challenges, and they have to be addressed in their own unique way, and we will do that with trusted partners in each of these areas. The goal of mitigating disparate mortality outcomes remains the same, but now we're looking further upstream in order to get ahead of the data. This means drawing on our toolbox of communications, outreach and engagement, prevention, testing and treatment, and additional supports and resources, and tailoring it for members of the Latinx community. This includes undertaking aggressive communications through a multilingual digital and video campaign with very targeted guidance from trusted community leaders, along with distributing postcards and door hangers directly to residents impacted in impacted communities, and making sure that we literally leave no communication stone unturned. Not everybody gets and receives their information in the same way. We know that, and we need to make sure that we tailor our outreach and communications efforts to address that reality. We will be coordinating with key community partners to move this work forward, including those folks who are here today, including Carmen Varega of Esperanza Health, who has already been part of the racial equity rapid response work from the beginning. We'll be bringing information and experts directly to our community members in a series of virtual bilingual town halls. The first will be in partnership with ARP and Univision, which will take place tomorrow evening and focus on our seniors, followed by an immigrant youth town hall hosted by Lori Children's and Chicago is With You Task Force. And we'll have a broader Latinx community town hall in partnership with the Marshall Square Resource Network that will kick off additional local engagements led by our community partners in the coming days. Our data has also revealed case clusters in industries and facilities with a high Latinx workforce. That's why we'll be working in partnership with local unions to do critical outreach, including SIU Local 1, Unite Here Local 1, and the Construction and General Laborers District Council of Chicago and vicinity. These partnerships will help us reach tens of thousands of Black and Brown union members, many of whom our city is depending on right now as essential workers, with critical information, wellness checks, and additional supports. We'll also be working with our healthcare providers across the city. The racial equity team has already been working with a committee of healthcare providers, which includes federally qualified health centers. This is essential in partnership with our community-based organizations. We'll ensure that residents who need housing for quarantine and isolation can gain access through the hotel system we have stood up over the past weeks. And these bringing these FQHCs into the mix will mean that patients who go there will then have the access to referrals to the quarantine and isolation centers. This is an interim solution, and we will continue to work on longer-term, more permanent options because it's going to be needed for the long haul. This is going to be critical for our families who live in multi-generational homes and need a safe space to get through this virus without risking the health of their parent, grandparent, or other vulnerable family member. We will also be working with FQHCs which also serve our uninsured community members to further increase testing and to ensure access to all community members. And we'll be partnering with our community navigators. You may remember them. These are the folks that are on the ground. They're trusted neighbors in communities who've done so much great work in educating people about what their rights are around immigration. That infrastructure, which is solid and strong and trusted, we're going to be leaning into that as part of this work to make sure that we're reaching as deep as we possibly can, block by block, into the Latinx neighborhoods. And let me say again, there are consequences of President Trump's hateful, xenophobic demonization of this community. We've stood up against this hate. We will continue to stand up against this hate. But now more than ever, we need to bring people out of the shadows. Whatever their fears may be, we have to make sure that we break through that to educate them about the opportunities to help themselves in the middle of this pandemic. And we cannot let anybody, no matter who it is, demonize our communities and scare them away from seeking treatment and getting education about this pandemic. I'm proud of the gains that we've made. But the reality is, even under the best of circumstances, we still have a long way to go before our lives go back to the way that they were. One thing that I don't want, however, is returning to normal to include the divides that we see in the data and the maps across our city. What we have to build is not temporary scaffolding to solve a problem for this moment. We have to build a foundation to address the health disparities for COVID and beyond. These divides weren't created overnight, and they won't be solved overnight. But this has got to be a call to action for all of us. And we are here to say we are up for meeting this challenge. We have to work to truly empower every resident, every family, and every community for generations to come. And with that, I will welcome my friend and a champion for his community and all Chicago, Alderman Gil Villegas, to the podium. Gil.
Thank you, Mayor. Before I start, I'd just like to say one of the best appointments you had was Dr. Rowdy. I'm glad she's here right now at this time. Good afternoon, everyone. I'd like to begin by thanking Mayor Lightfoot for putting together this Latino COVID-19 engagement strategy specific to the needs of the Latino community, which we all know continues to be greatly impacted by this pandemic. I've heard directly from my community, which is one of the hardest hit, and many are asking me what they should do. How are they going to move forward from here? When can they go back to work? These are all valid questions, as every day we see Latinos struggling to pay for their housing, their food, health care, and daily needs. Some aren't able to go to work, and others are no longer employed. Many are helpless because they don't speak the language. Others are scared to visit their local hospital, while others lose all hope because they are seeing their businesses closed and possibly not reopen. Businesses they work so hard to build. Too often, the Latino community is left out during challenging times, left out of resources or additional support for reasons I can't understand and won't accept. That stops today with COVID-19 Latino engagement strategy. This is all possible because of the work of this administration, an administration that strives to work with all of us no matter where we live. I do know a couple of facts about the Latino community. We are resilient and hardworking. We will not give up. I'm ready to work with everyone to ensure that our Latino community receives the support and resources needed, and our community comes back even stronger. And with the support of our mayor and our city council and all of our community partners, we will do everything in our power for the Latino community to make a full recovery. We must remember that we are in this together. We will get through this only by working together. Thank you, Mayor.
Mr. Elias.
Thank you, Mayor. Thank you, Alderman. My name is Efren Elias, Vice President of SEIU Local 1. SEIU Local 1 represents 50,000 proud janitors, security officers, residential workers, and more across the Midwest. These are the working people who are on the working side by side during this crisis to keep public spaces clean, safe, and healthy every day. These workers do not have the privilege of staying home and cannot work remotely, and they are most likely to be affected by COVID-19. This epidemic, however, reminds us that our well-being is connected. This week, we've seen the number of COVID-19 cases rise rapidly in the Latinx neighborhoods. Our union is very diverse with a broad Latinx population, and it is more crucial now more than ever to work with our elected officials side by side, share resources for our most vulnerable communities. We cannot allow COVID-19 to continue to harm Black and Brown Latinx communities. We are coming together for clarity on how this virus is impacting our communities and make sure every one of us, regardless of our color or where we live, we could get the right treatment, the right care, and the support that we need. No one should have to choose between their health or their job. That's why Local 1 has implemented a 5-point plan to protect the livelihoods and well-beings of Local 1 members throughout the city who are on the front lines of this crisis. Labor organizations with strong Latino and immigrant memberships like SEIU and others are ready to work alongside Mayor Lightfoot, the city administration, to get information and resources to working families who need them most. Chicagoans need to stand together across our differences to protect ourselves and those that we love. Thank you. Carmen Varaga.
Please.
Thank you, Efren. Thank you, Mayor. Good afternoon, everyone. My name is Carmen Vergara. I am the Chief Operating Officer of Esperanza Health Centers. Esperanza is a federally qualified health center known as an FQHC that provides primary care services to about 30,000 patients a year across 4 locations, all located on the south and southwest side of the city. 95% of our patients are Latinx, and most prefer for their care to be delivered in Spanish. Over the past few weeks, Esperanza has been learning, growing, and fine-tuning our response to COVID-19. On March 14th, our team bravely tested our first patients, and since then, we've been working hard to ramp up. We're now testing about 150 patients a day, something we wouldn't be able to do without the supplemental testing supplies that are being provided by the Illinois Department of Public Health. To date, we've tested over 2,000 patients, and of those, over 1,000 have been positive. This is a positivity rate of over 50%. That's incredibly alarming to Esperanza and to the patients that we serve. Specific to the Latinx community, Esperanza has always been a medical home to residents who are uninsured. Many are uninsured because of their immigration status. And although we don't track a patient's immigration status, we can surely estimate that about 25% of our patients are undocumented. Because of this, we made it abundantly clear that there would be no cost associated with any COVID-19 testing or any of the follow-up care. And because of that, 52% of the patients that we have tested are uninsured. Among our population, what we're seeing that the biggest risk factors are the place of employment. Many of our patients are essential hourly workers who do not have the privilege to work from home. In addition, once somebody does test positive, it's really difficult and challenging to self-isolate at home, as many folks live in multi-generational homes, and then there's also a crowded housing issue. FQHCs right now are really busy balancing the need for more COVID testing while also delivering their core primary care services. Aside from increasing the COVID testing, our team has in the past month ramped up a telemedicine program so that patients can continue to seek primary care services with their doctor. This is incredibly important, especially for patients who have pre-existing conditions. To date, we are seeing about 400 to 500 patients per day through telemedicine. And we're starting to plan now how to continue to provide these services safely in the next weeks and months to come. FQHCs are the backbone of the city's primary care services and are therefore essential to any successful testing strategy. We understand the needs of our patients, we understand the needs of our community, and we know that right now our Latinx community is most vulnerable to COVID-19. And with testing, we can work through this pandemic. I'd really like to thank Mayor Lightfoot and the public health systems of Chicago and the state of Illinois for all of their support over these past few weeks. In Spanish. Hola, muy buenas tardes a todos. Yo me llamo Carmen Vergara, soy la directora de operaciones de la Clínica Esperanza. Esperanza es un centro de salud federalmente calificado que da servicios primarios a más o menos 30,000 pacientes al año en 4 sitios en el sur y suroeste de la ciudad de Chicago. 95% de nuestros pacientes son latinos y prefieren que les demos su cuidado y que la atiendamos en español. En las últimas semanas, Esperanza ha estado aprendiendo cómo responder al COVID-19. El 14 de marzo fue la primera vez que hicimos una prueba con un paciente y desde entonces estamos escalando para hacer más pruebas. Ahora estamos haciendo más o menos 150 pruebas al día y con el apoyo del estado de Illinois y las pruebas que nos están mandando. A la fecha hemos hecho 2,000 pruebas y un poco más de 1,000 han salido positivos. Y ese es un porcentaje de más de 50% y es algo que nos preocupa mucho y es muy alarmante y es por eso que estamos aquí hoy. Específicamente a la comunidad latina, Esperanza siempre ha dado cuidado a personas que no tienen seguro médico y muchas veces eso es por la razón de su estatus inmigratorio. Y debido a eso queremos dejar en claro que no estamos cobrando para las pruebas de COVID ni para el seguimiento que puede seguir después de eso. Lo que estamos viendo en nuestros pacientes es que muchos son trabajadores esenciales que no pueden trabajar de casa y en cuanto están positivos es muy difícil aislarse en casa porque viven varias personas en la casa si vivimos en familia. En las clínicas como Esperanza ahorita también están tratando de balancear cómo hacer más pruebas y a la misma vez seguir nuestro cuidado primario. Y es por eso que a partir de hace un mes empezamos a hacer telemedicina para que pacientes con condiciones preexistentes como diabetes o asma o alta presión sigan en un seguimiento con su doctor primario y pueden hacer eso por videoteléfono o por teléfono. También estamos planeando ya cómo podemos seguir dando buen cuidado en las próximas semanas y meses, como sabemos que todavía no hemos llegado al tope de COVID. Clínicas como Esperanza son parte fundamental de los servicios primarios en nuestra ciudad y es por eso que es muy importante que sean parte de la estrategia de seguir haciendo pruebas y detección. Nosotros entendemos las necesidades de nuestros pacientes y de nuestra comunidad y ahorita sabemos que nuestra comunidad es muy vulnerable al COVID-19. Quiero darle las gracias a la alcaldesa Lori Lightfoot y a los sistemas públicos de la ciudad y del estado por todo su apoyo en estas últimas semanas. Gracias.
Now we're happy to take any questions you have.
Mayor.
Good afternoon.
Good afternoon. Good to see you. The increase in the Latino cases has been at a rate of 1% per day in the last 10 days, if I'm not mistaken. And my math is not great, but my projection indicates that in 2 weeks, we're going to be at about 50%. Are Latinos going to be 50% of the cases?
Well, I'm going to invite Dr. Hardy to verify your math. But the thing that I know is that given the sharp increase that we've seen, particularly over the last week to 10 days, that's why that brings us to this moment to, one, sound the alarm, come together with community partners and make sure that we're doing everything we can where we're seeing this surge in the Latinx community to head it off. I hope you're wrong about what we'll see going forward. We knew that there was an undercount. That's why we placed such emphasis and really a direct order to the various testing services to make sure that they were including the demographic information. But we are concerned, and that's why we're kind of marshaling all these additional resources to make sure that we head this off. And we do that by bringing together trusted community partners, having a health and data focus, and then making sure that we're educating people and listening to what we're hearing from them about the unique circumstances that they're finding in their communities. Every community is different, every family is different, but we need to make sure that we are, as a city, rising to the occasion and responding to this need. And Dr. Hardy, I don't know if you want to.
I'll just speak.
Okay.
Yeah, what I would say is that we have not seen a flattening or a peak yet among our Latinx cases. And so it would be premature to predict where fully that will go, but I would say that at this point we would likely continue to see some increase for some time. Our goal, of course, is to drive testing, and as you know, testing will also drive an increase in cases. So at some level, seeing that increased testing and increased cases is a good thing, but we do obviously want to see some flattening there. I also, as long as we're talking about looking ahead, I would expect that we may see more deaths in the Latinx community as a percentage than we've seen also. It's really just in the last 2 weeks that we've seen the cases among Latinx Chicagoans really exceeding what we're seeing in particularly non-Latinx Black Chicagoans, and there often is a lag of a couple of weeks because people very rarely die suddenly from COVID. It's usually something where people get admitted. So we're keeping an eye on it. I think at this point, we're already already, where you think about 29% of the population versus 37% of the cases. That in and of itself, knowing what we know about underlying conditions and everything else, is not surprising. I think we'll see some increase for some time and hopefully see that peaking soon.
Last week, Dr. Ezequiel said that this increase has to do with the fact that a lot of Latino families live in the same building, a lot of generations under the same roof. And there's an argument to be made about the fact that a lot of Latinos are essential workers, that they might be getting COVID at their workplace in factories that are not safe. Those two issues are endemic issues in the Latino community. Why has it taken so long for the city to react to those?
Well, we've been reacting to this from day one. We've been deep in the Latinx communities for some time. The difference is what we're seeing is a surge. And that's what's bringing us here today. But what I would also say is part of, I think, why we're seeing the dramatic increase in the numbers is, like with the Black community, the Latinx community also has lack of access to health care. Underlying conditions like diabetes, heart, upper respiratory, some of those same underlying conditions that make them vulnerable and make them more susceptible to the ravages of COVID-19 also exist in the Latinx community. This is a new thing, and we've been very much active and engaged in these communities for some time now. But the difference is we're seeing this surge, and that's why we're issuing this broader call to action. But on the part of the city, we've been active and engaged in these communities from day one.
To the point of the workplace infections, a lot of people were wondering why the city hasn't enforced the rules more forcefully.
Oh, I think we have. We certainly have been working with private sector employers. We've been working with our union partners to make sure that workers are protected, particularly workers who can't afford the luxury of teleworking, which, again, is an issue that is prevalent in Black and brown communities. We've been going hard in these workplaces to make sure that workers are protected and that they're safe on the CTA when they travel from their neighborhoods, whether it's buses or on trains. The public transportation system has been a big area of focus for us, and it will continue. The workplace will continue to be a focus for us, whatever kind of workplace it is.
Okay, Robbie Wishwald from WLS wants to know why did the mayor prevent Willie Wilson from giving away 5 million masks at the United Center today? And what is the mayor's reaction to reports of shopkeepers and other perhaps inappropriately trying to enforce compliance with the mask wearing directives?
All right, so let me take, those are two separate questions.
Yes, ma'am.
I'm not aware that there was any option by Willie Wilson to give away masks today at the United Center. I received some notification yesterday from Dr. Wilson about something that he planned in the future. I asked a series of questions, which you would expect me to ask, which is, do you have a permit? What's the security plan? And when you talk about 5 million masks, that's a lot of people coming together, and probably my concern was violating the state's stay-at-home order, but I wasn't aware of something that was supposed to be happening today. And remind me the second question.
The other question was about shopkeepers and others perhaps inappropriately trying to enforce compliance with the mask-wearing directives.
Well, I don't know what you mean by inappropriately, but the directive from the state has been clear. We're urging people who are going out into congregate settings where they can't safely social distance to wear some kind of face covering for their own protection. I know that stores are trying to encourage that on the part of people that are coming into these settings, but I'm not aware of anybody inappropriately trying to do that.
Tonia Francisco from WGN says a group of community organizers and church leaders are holding a press conference today at 1 p.m. too. They claim families with no technology are not receiving computers or access to internet. Teachers, parents, and students are not being effectively trained on the technology. There is no articulated plan from the Chicago Public Schools to address the social, emotional, or academic needs of children when traditional school returns. They claim the mayor has the power to do something about it.
Well, I'll try to respond to that paragraph of invective. Number one, CPS announced, I think well over a month ago, what their plan was for remote learning. They have passed out literally tens of thousands of devices from their own stockpile. They've received a number of devices that they've also put in the hands of their students to make sure that they are in fact connected. Has this process been perfect? No. But are they continuing to work at this issue? Absolutely. But this really raises a larger question of the digital divide in our city, which we are very much focused on in partnership with a number of different groups. And I'm going to be pressing the big carriers to solve this problem. It's a simple matter of dollars and cents. And the question is, are they going to put their profits over the needs of people in low-income neighborhoods who have every right to be connected, not just for school, and school is important, but businesses, individuals. We are living in a digital age. We are providing information to critical health information to people digitally, and we need to make sure that every neighborhood is connected, and the power to do that rests with these carriers, and they've got to step up. Now, I know that some of them have programs, but there are flaws in those programs, and we need them to work cooperatively with us at the city level to solve the problem. When we've got, for example, I heard a story the other day that somebody was willing to donate money to take care of a group of students that work in a particular program, and a carrier told them, no, you can't give that money. That's ridiculous, and we've got to break through that because we have to solve the digital divide. Alderman Villegas is going to be working with a group of businesses to make sure that there are resources in his community to address this very digital divide. And Gil, I don't know if you want to come up and address it, but this is a problem in lots of different areas. And now when we urgently need our families to be connected, the students, the elders, the business people, the providers have that power in their hands, and they have got to put people over profits. Alderman?
Thank you, Mayor. I think the mayor hit it on the head about challenging corporations, and I think that's what we've been doing as a chairman of Economic Capital and Technology, reaching out to technology companies to find out what can we do to make sure that those kids that do not have free Wi-Fi, how do we get them connected so that way they're successful? And as a result of that simple call, we've had some companies like Ignite City step up, identify some resources where there's trenchless technology that provides Wi-Fi, and the mayor's talking about these other large carriers. I would caution these carriers to come in, see the mayor, so that way we can put together a plan to help out the city, especially right now.
Franz Spillman says Governor Pritzker is getting pushback about his plan to reopen Illinois from those who say it's too conservative, moves too slowly between phases, and establishes too many hurdles to get there. What is your reaction, and how will the city guidelines that you are developing for Chicago residents, businesses, and visitors differ from the governor's plan?
Well, we're going to propose Chicago-specific guidelines that are a complement to the governor's plans. And like with the state plan, it's going to be driven by the data and the science. Look, I understand that people are anxious. I'm anxious too. I worry a lot about particularly our micro businesses and the workers that are affected and employed by those businesses. If there's not a solution soon, they're never coming back. And they've already been devastated. So we want to open up our city, but we have to do it safely. And we have to do it at a time where we see that there's actually a decline in cases. It's ironic that we're having this conversation in this moment when we're talking about a surge in cases in the Latinx community. We are not where we need to be yet. We hope that we're getting there. We're certainly seeing progress, and we talk about that, and Dr. Artie in particular talks about that on a regular basis, how we are absolutely seeing a flattening of the curve overall, but we know that there's some unique challenges in certain communities, but we can't send people back to work. We cannot open up our city yet when we don't see a decrease in the cases, which we've not seen yet at all, and when we don't see a sustained decline, a sustained decline in hospitalizations, ICU beds, all of those things are really important, and the data has to drive what we do from a public policy standpoint.
Okay, Vince from Channel 2 asks what kind of economic loss does this represent for the city, the cancellation of Pitchfork he's talking about, and can you quantify what the city may lose with the cancellation of a growing number of festivals? And to that point, is there any update on the Lollapalooza?
I don't have an update on Lollapalooza, but we continue to engage with the producers and the organizers to make some determinations about what the status of Lollapalooza will be, and as soon as we know that, we'll let you know. Look, every one of these cancellations, really going back to the start of the cancellation of the conventions, these large events that attract people from not only all over the region, but all over the country, that has economic impact. Can I tell you precisely what the dollar amount will be? I can't, as I sit here today, but clearly we know that as a result of our stay-at-home measures, that there has been significant economic impact in the city, in the state, in the country. And we are working very diligently to make sure that we understand and quantify that. As I've said before, there's definitely going to be impact. We're in a better position than some other parts of the country because we have a much more diverse economy, and we have revenue streams that aren't as sensitive as others. But make no mistake about it, there's going to be a significant impact in the 2020 budget and in the 2021 budget.
Jesús del Toro from La Raza says immigrants are especially vulnerable during this crisis, both in health and economic terms. How is the city coordinating with the state of Illinois to increase COVID-19 testing in Latino neighborhoods? You answered some of that during your presentation. And also, do you have plans for additional rent mortgage support in Latino neighborhoods?
So we are continuing to look at ways in which we can expand testing, and we'll have some specific announcements on that later. But suffice it to say, where we want to make sure that we are using the data to identify those areas that are most in need, and clearly increasing testing in Latinx community is a priority. It has been a priority. We've seen a surge and an increase in that testing, but we have to do more all over the city, but particularly in Black and brown neighborhoods. And tell me again the second question.
The second question was...
rent.
Yes, rent, exactly.
Look, it's a very tough issue. And as I've said before, we were here last week. We announced the Solidarity Pledge, which brought banks who are the holders of mortgages, landlords, renters, and their associations together. This is a problem that's got to be solved by the federal government. I'm hopeful that in the next package that comes from Congress, that there are going to be more resources available to help landlords and help renters. But fundamentally, the banks have to give forbearance on the mortgages. Bottom line, that is not a power that we have at the city level. It's not a power that we have at the state level. But we are, myself and the governor, using our respective bully pulpits to continue to press the federal government to provide relief so that people who are really struggling know that they're still going to have a home and not have to worry about evictions.
Craig Delamore asks, Mayor, political candidate and philanthropist Willie Wilson is saying that you and Governor Pritzker have not been supportive of his effort to donate 5 million masks to poor people across the city. He wanted to distribute masks at the United Center. It's kind of the same thing you've been asked before. And he says that he could not do it. He also says that if people need masks and the city cannot provide them, then why can't he make donations?
Well, look, God bless Willie Wilson for his generous heart. He's been very generous with his own resources, really going back probably decades. And I'd say the same thing to him that I would say to anyone else. We have to do what we do consistent with the state law and guidance. 5 million masks sounds like a great thing. Let's see what your plan is to make sure that we're doing it in a way that doesn't have masses of people gathering, that we can do it safely, that people who are out there are going to be protected. So We are doing our distributions in a thoughtful way that's consistent with the guidance, consistent with state law, and that's what's got to be done for anybody, whether they're donating masks, whether they're donating PPE, whether they're donating food. It's got to be done in a way that puts public health and public safety first and foremost.
Tiffany Walden has 3 questions. I'm going to ask the first one. She says, as the video of you approaching the black youth on Saturday circulated on social media, some critics believe that your approach was harsh. Instead of creating an opportunity to educate, engage, and inform the youth while also maybe passing out masks to the youth, you walked up and told them to go home in a distant, matter-of-fact tone. Do you think you could have handled the situation differently? If so, what would you have done?
Well, those were a lot of young teens and preteens who were gathering on a playground that was closed, and I said to them, as I'd say to my own child, hey folks, hey fellas, you got to go home. That's what I said. And many of them actually had masks, which was a good thing.
Okay. Adriana Cardona Maguigad asks, in regard of your effort to crack down on parties and groups of teens playing ball at the park during COVID-19, some teens in the South Side and West Side still criticize the way in which you have spoken to the community, kind of the same type of question. Is there going to be any type of change in the approach?
I think it's the same thing. I talk to those young people the same way that I would talk to my own child, which is think about the risk. Don't put yourself in a difficult position because we know that clustering, particularly contact sports, those are very, very risky. There's a reason why the NBA shut down its season. We know that that kind of physical contact is exactly the way that you spread the virus. So I think what we've said with regard to contact sports is exactly the same that the major sports leagues have said. You can't do it. It doesn't make sense. It's not wise, not only for the individuals who are engaged in the activity, but what I would also urge our young people to think about is think about what you're going to be doing to the people that live in your household. There are many young people that live in intergenerational households. There are many young people who live with people who have underlying health conditions. So when you put yourself in a party or a large gathering in this time, when we see that COVID is still on the rise, you're not only putting yourself at risk, but you're putting all those that you come into contact at risk, the people that you love the most, your family members, your friends. So I'm just asking young people to be smart, and to stay home, because we know that by staying home, we have been in flattening the curve and that we are doing a lot to save people from death.
Dr. Arwady, she asks if you can detail the drop in African American coronavirus cases.
So I would refer back to the second slide that I showed, if people want to take a look at that. Basically that's that purple line there, where we are still seeing 37% of our cases in Chicago among African Americans. So I do not want to give an impression that we are in any way done with working on coronavirus in any of our race or ethnic groups in Chicago. But what you can see in that graph is, and this is really week by week, is about 4 weeks ago we did see some peaking there. We are still doing a lot of testing among African Americans, and sometimes we have to adjust what some of our cases look like for testing rates. But I am heartened when I see graphs looking like that. That's what I need that blue line to look like. That's what we need all of our lines, and that is what we need Chicago's line really to look like, and that's what we hope we'll be seeing coming in the days and weeks to come.
Thank you, folks. Hold on one second. Let me just underscore a point that Dr. Arwady just made. No one should take from our comments today that we're declaring victory in the African American community. Far from it. We're still seeing a disproportionate number of Black Chicago as people who are dying as a result of COVID-19. So it's progress, but it's certainly not victory by any stretch of the imagination. We still have a lot of work to do in Black and brown communities. Yes, ma'am.
Thank you, ma'am. Unfortunately, we don't have any more.
Okay. All right. Thank you all.